The Belize Central Prison has instituted a complete confinement of all inmates for their own safety, following the identification of more positive cases of COVID-19 behind its walls. For the 21 days that commence on Tuesday of next week, all visits, cash deposits for inmates, and business transactions with customers of the prison will be suspended. Earlier today, Director of Health Services Dr. Marvin Manzanero shared the latest figures from the facility.
The data I have is that we do have 8 prisoners that have turned up, persons involved in the security measures at Colby Foundation, and that is mostly as a result of the sweeps done on Tuesday and Wednesday of this week. This would include the initial persons that have identified, and then the further ones identified earlier in the week.
Adhering to social distancing protocols in prison is rather difficult, if not virtually impossible, considering the fact that inmates often share communal spaces, including cells and other facilities. So where in this sprawling compound are sick prisoners housed?
We have various quarantining units depending on where they are identified.
So they wouldn't at any point while they're positive commingle with the general population?
Absolutely not. And that they have to wait that out until 14 days time. And after 14 days time, then we will have them do another test, PCR test, and depending on what that result is, it will be determined whether you take them out and place them back into the main population, or you keep them for a further 14 days if they are positive.
The dreaded pathogen finding its way to the Belize Central Prison was inevitable, despite all previous efforts undertaken by the Colby Foundation to keep COVID-19 at bay.
The biggest concern of mine has always been the prison staff when they're on their day off, or when they leave the prison to go home. They would act irresponsibly and go mingling with people who may possibly have the virus, and then bringing it into the prison and infecting their colleagues and, of course, the inmates, because inevitably they have to interact together. So that is always my biggest concern, and I keep emphasizing to staff that they must stay at home if they don't need to go anywhere, and of course practice all the other measures that are in place to prevent COVID-19.
So are these measures taken by the Colby Foundation in conformity with regional best practices in managing an outbreak behind prison walls?
Well, I think for the most part we are doing what is required by WHO standards, because the CARICOM impact standards, or the standards that we have in place for the region, is pretty much in line with the World Health Organization standards. The only thing we haven't been doing here is really offering what you call video calls for prisoners and their loved ones. They maintain telephone contact, which is also one of those options available.
Reporting for News 5, I am Isani Cayetano.